As California continues to reopen, it feels like things are finally getting back to normal, especially since the CDC scaled back their guidelines this week in regards to masking and social distancing for people who are fully vaccinated. But for many, this sudden shift is bringing up a lot of new questions. Here to help us break some of those down is Rob Fuller. He's a partner with Nelson Hardiman, healthcare lawyers. You are an expert on anything healthcare and law related, so thank you so much for joining us, helping us break all of these things down.
Good afternoon.
The big question now is what happens to all these mask mandates from individual stores and retail chains to cities and states. All the existing mask mandates seem to be based on CDC guidelines. Many states have responded to these new guidelines by lifting their mask mandates, but California has decided to not do that. So why is California keeping these restrictions, and can they do that?
Well, right now we have basically an honor system on CDC guidance. You have the scientifically based finding, which is terrific, that if you're fully vaccinated, your risks are so low that the mask wearing and the social distancing doesn't add much to your own safety. The issue with California is that I believe it's still only about 35 or 40% of the population is vaccinated. So the messaging from the California is that, well, most people still need to wear a mask and need to socially distance because they're not fully vaccinated. We don't have vaccine passports, and no one is checking your medical record to go into a Ralph's supermarket or anything. But, people being what they are, if they're really not inclined to wear a mask, and they're just going to say they're fully vaccinated and walk around. So I think California is taking a bit of a more conservative approach until the total vaccination numbers increase to a little larger level.
What about retail businesses? Trader Joe's announced yesterday that customers can shop in their stores maskless, but what about California locations? On the flip side of that, what about stores that want to keep their mask mandates in place? Can they do so even if the state lifts the CDC, accepts the CDC guidelines?
Yes, private businesses are free to, admit or not admit people. No shirt, no service is a common sign in most restaurants. So you do have the ability of private businesses to establish their own requirements for entry to their place of business. Businesses are all, required under OSHA regulations to make sure that they offer their employees a safe workplace. And if the business owner doesn't feel that it's quite safe enough yet to admit people without masks, because so many are still unvaccinated, especially in California, it's within their prerogative to do so. They certainly can require masks for entry.
Interesting. Now, when it comes to individuals, specifically kids under 12 or professionals who may be immunocompromised or uncomfortable with going back to normal, can these folks be required to return to the classroom or the office, even if they've been working safely and efficiently from home?
Well, that's a large population there. I believe that in the case of the children, again, the primary group that needs to be protected are the teachers. And if the prevalence of the virus is such that they think that the teachers are fairly protected without masking, then the children could be required to come back to school. Children are treated differently in that case. For people who are working efficiently at home, that's a matter between them and their employer. That they may not want to go back to the office. They may not feel as safe going into an office building as they are in their own house. And most employers, I think, are taking note of that, and on certain positions where you can contribute and get your job done from home, that is an accommodation that is made. It's not covered by law, though. It's strictly the business owner's choice. It's not a disability under the Americans with Disabilities Act or a civil right to have your place of work be one place or another. But hopefully, in most cases, common sense will prevail, and people who are immunocompromised, who don't feel safe yet because the virus is still out there a lot, and because 40, 50, 60% of the people are still unvaccinated, it seems reasonable to allow those people to continue to work at home, at least for the next few months, while the vaccination levels come up and the virus levels hopefully go down.
Yeah, like you said, hopefully common sense will prevail on this.
And it's been a tough one during this pandemic.
Absolutely. That's Robert Fuller with Nelson Hardiman, healthcare lawyers. Thank you so much for helping us digest all of this new information.
Anytime. Thank you very much.